Hi, my name is Terry Dorland with Rise Local TV, and today we're here with another expert interview, and I'm very excited to be joined by Dr. Robert Perler, who's a dentist in New Rochelle, New York, and we're going to be discussing finding a great dentist and really what you should be doing when you're out there looking for a new dentist. Dr. Perler, how are you doing?
Fine, Terry. How are you?
I'm doing fantastic. It's really great to have you here. Dr. Perler, okay, help us out. You know, if someone's out there looking for a new dentist, there's obviously a million different ways you can go about trying to find that. In your expert opinion, what do you really think someone should be doing if they really want to get a good provider and a great dentist?
Well, if you've moved into an area, what's worked in the past still works today, and that is you could ask your new neighbors, ask your relatives who live in the area, and new friends who they use, and that's someone who you should consider using. At that point, you can go to the internet and see what the reputation is, how many reviews they have. Obviously, you want as many positive reviews as possible, and from that, hone down, cut.
Okay, we'll keep going. What I'll do is I'll pull it down, and then we'll do a quick cut on it and then re-upload it. So I will just go ahead and start the broadcast one more time.
Okay.
So I'll be staring at the camera and start just like I started before. Hi, my name is Terry Dorland with Rise Local TV. We have another expert interview with us today. We're going to be discussing finding a great dentist and really what you should be doing when you're out there looking for a new dentist. I'm really excited today to be joined by Dr. Robert Perler, who's a dentist in New Rochelle, New York. Dr. Perler, how are you?
Fine, Terry. How are you?
I'm doing fantastic. It's great to have you here.
Thank you.
Okay, Dr. Perler, so help us out. You know, when someone's out there looking for a new dentist, what kind of steps should they take to ensure that they're finding a good provider and really getting a great dentist?
You know, Terry, what's worked in the past still works today, and that is if you've moved into an area, you can ask your new neighbors, the friends that you've made, or your relatives who live in the area where they're using, and that's someone you should consider using yourself. From that point, you can go to the internet and check their reviews. You can check their websites. You're looking for a lot of positive reviews. You can go to Google, ChatterHub, DemandForce, and see what the reviews are like. And from that, you can whittle down the number of dentists that you want to see, go to their websites, and take a look at what their expertise and experience is. You could also see what their educational background is. You could see what schools they went to, what courses they take, and you're really interested in the continuing education courses because you want a dentist who holds himself to a higher standard than that's required of him. And there are organizations like the Academy of General Dentistry that require that you take more continuing education courses each year than those required of the state, and that's important. So again, just to reiterate that, you want a dentist who holds himself to a higher standard than that required of him. So after that, you know exactly what his educational background is. You want to have an idea how good he is as a dentist. You have the recommendations from the people in the area, but another thing you can do is you can call the dental labs in the area because it's the dental lab owners and managers, and I'm talking about the local dental labs, not the foreign dental labs. Local dental labs use the best materials. Their owners and managers know who their best dentists are, you know, with their hands. So now you know your educational background, who's a good artist and a good dentist. Then you can make an appointment in the dentist's office and let the patient's experience dictate as to who you like. You know, with all technology improving in all fields all the time with new materials and new equipment, you want to make sure that a dentist has everything that is the new standard, because when the standard of care increases by new equipment, that is incumbent upon that dentist to invest in that new equipment. So you'll make an appointment and let the office experience be the deciding factor in who you want to choose as a great dentist.
Well, that makes a lot of sense, and that's something I haven't heard before. You know, looking at the reviews, you talked about friends and family. Those make a lot of sense, but actually talking to the dental labs is something I hadn't heard before. So that's something that sounds brand new to me and really would make a lot of sense. They're experts in their field. They know who does good work and who doesn't. So beyond that, Dr. Perler, I know you're doing some great things at your office. Talk to us a little bit about the patient experience if someone were to come in and see you.
Well, in our office, we have a very friendly office and a friendly team in our office. There's good communication at our front desk and from the front desk to the back office where I am. I came into dentistry through biomedical engineering. I was doing surgery in the 1970s on dogs with implants and biocompatibility of implants, and that's how I came into dentistry. I hold 9 patents in the dental and medical field. So I brought that into dentistry, and I feel that we're able to bring a higher level of care in dentistry through biomedical engineering. So as a result of that, we embrace new technology. In our office, we have intraoral camera and digital imaging, but most important, we have the use of lasers and 3D milling. We're able to do CAD/CAM dentistry, meaning we can take digital imagery of patients' teeth, make crowns, laminates, and inlays the same day, that is, fabricate them and actually cement them so patients who live a distance away are able to have something that's done in the same day. We also have a number of lasers that we use in the office. 2 for diagnostic purposes. One is called Diagnodent for finding caries, that is, cavities inside the teeth. And we use a Velscope for looking underneath the surface of soft tissues to find lesions should they exist. Then on the operative side of dentistry, we use a water lase. The water lase is able to cut teeth without the use of local anesthesia. This is a great adjunct to dentistry, especially for little children who are afraid of getting injections. And here you can actually cut a tooth and prepare it and fill it using water lase without the use of anesthesia. So basically that's it for technology. At that point, you're going to the front desk and you want options for financial planning, which we offer. And ultimately, you want to be able to address all of the patient's concerns, leave them with a happy smile. You want them to refer their friends and their family to you. And that's the experience in my office.
Well, that sounds like it's extremely not only technologically oriented, but also geared towards giving those patients a positive experience from the time they walk in to the time they leave the office. And I know, speaking of that, Dr. Perler, I know you have a really special offer for potential patients who happen to be watching this video to really give them a good reason to come in and see the difference that your office has to offer. What do you have for patients who happen to be watching this video?
Well, Terry, for your viewers who are seeing this video online, we decided to offer them a free initial exam and consultation, as well as a free set of intraoral and extraoral photos, probably about a $300 free gift for these patients. And we think that would be a great incentive to bring patients into the practice, and that's what we're offering at this time for your viewers.
Wow, that's a really great offer. What's the best way for people to get a hold of the office and take advantage of that?
Best way to get in touch with us is our phone number. It's 914-636-8082.
All right, Dr. Perler, I really want to thank you for being here. You have provided a fantastic offer and as well some really great insight to our viewers.
Thank you for having me, Terry.
All right, everybody, thanks so much for watching another edition of our expert interviews. We look forward to seeing you again in the near future. Today we discussed finding a great dentist. Next time we'll be discussing finding another wonderful provider. We appreciate you watching today. Okay, so that went well. There was a couple of times where we lost internet quality on your end. I could tell from watching it dramatically. So let's do the first 2 questions one more time, and hopefully we'll get a better cut off them. That way, I'll be able to just grab the different pieces and put them together and grab the good stuff. So the introductions went fine. So if you could just go one more time into what you would do and the steps you would take when looking for and finding a new dentist.
So you want to answer to question number one a second time.
Correct.
Okay. You want me to go right into it?
Yeah, just go right into it.
Okay. Terry, what's worked in the past still works today. That is, if you've just moved into an area, the best way to find a great dentist is ask your new neighbors, maybe your relatives who live in that area, and the new friends you've made who they're using. And that's someone who you should consider using yourself. You could take that information from those people and then go to the internet, see demand force. You want the most positive reviews, and from that, go to their websites. The websites will give you a tremendous amount of information as to their expertise, where they are, what services they offer, and their educational background. Speaking of their educational background, probably the most important thing would be the number of continuing education courses they've taken. You want a dentist who holds himself to a higher standard than that of what is required of him, meaning most states have minimum requirements of what dentists have to take in terms of continuing education. There are organizations like the Academy of General Dentistry that require more continuing education, and that is someone who you should consider going to. Ultimately, you're going to have to make an appointment in that dentist's office and let the patient's experience dictate as to who you would like to see. There's another thing you should consider. Once finding out what dentist experience is, you can also call the dental labs in the area. The local dental labs use the best materials. Their owners and managers know who their best dentists are. Now, you know who best dentists are based on their educational background and their hands and artistry to make an appointment in that dentist's office. With dentistry constantly changing like all other fields, you want to make sure that this particular dentist is up to the standard of care and has all the latest, greatest equipment in his office. And you be the judge after going to that office, making an appointment. You want this dentist to listen to you and address all your dental concerns.
Perfect. Okay, that went better. And then go into as well your office and the special things that you do and kind of the patient experience there.
In our office, we have a friendly office. It's a friendly environment. We have a friendly team. There's good communication between the front desk and the patients, and good communication from the front desk back to the back office where I'm located. I pride myself on being up to date with the latest technology. As a biomedical engineer, I came into dentistry doing surgery on dogs and biocompatibility of dental materials in the 1970s. I hold 9 U.S. patents in the dental and medical field. So in our office, we have intraoral camera, we have digital imagery, we use lasers, we use CAD/CAM milling. Just to give you a little idea what that's all about, we can take digital imagery of a patient's tooth and recreate it in the office for a crown, a laminate, or an onlay in the same visit, such that a person who is living at a distance can have a final restoration that is really good for people who live far away versus the old technique of having to have a lab spend several weeks making that restoration. With the use of lasers, we can diagnose teeth better for caries using Diagnodent. We also use Velscope to look at the soft tissues of the mouth. And as far as children, we have waterlays, which allows us to drill with the use of a laser without the use of anesthesia. This is great for children, so without requiring a syringe and conventional drilling, they have no discomfort in that area. Also in our office, we offer several kinds of financing at the front desk, and ultimately, you want to leave a patient happy and smiling, make sure you addressed all of their concerns, because you want patients to refer their family and friends to you.
All right, good. All right, what we'll do is I'll take the best cuts from that, put it together, and we should be good to go.
I hope so. My verbiage keeps changing each time.
But it's all right. It's not. You're saying the same thing, just in a slightly different way.
Okay.
So I mean, your answers came out great. So I think we're pretty good to go here.
Well, for our sake, I hope so. Looking at my mug. Anyway, I hope this all worked out. You'll let me know.
I will. Well, I'll upload it and I'll send the link over to you guys. Hopefully this afternoon. If not this afternoon, tomorrow.
Okay, great. Have a
All right, Dr. Perler. Have a good one.
You too.
Bye-bye.